One of the great things about receiving cancer care here at Overlake is that patient care is individualized. It's tailored to the unique needs of the individual patient.
Well, cancer patients are treated by a number of specialists because cancer is not just limited to one organ and can't be dealt with just one modality. It requires a team effort and requires you to approach each cancer individually based upon how it is presenting and where it is, and that requires a spectrum of different approaches.
We have expert physicians in medical oncology, radiation oncology, surgical specialties, and we're also fortunate to have what we call patient navigators. So we have an American Cancer Society patient navigator, and we also have a lung cancer patient navigator that help with coordination of care for the patients. It's a complex healthcare system, and cancer is a complicated disease, and so to be able to have navigators that help direct the patients and expedite treatment is really critical to a cancer patient's success throughout treatment.
My primary focus is to work with outpatient oncology patients and their families. I provide emotional support counseling, resource management, education, information, help navigate them through the hospital system.
So my job is to help patients identify their needs and then connect them with resources through Overlake, through the American Cancer Society, and also through the community. So that can include things like transportation assistance, prescription assistance, financial assistance, connecting the patient with emotional support resources.
I think what sets Overlake apart from other facilities is the communication between the physicians, the nurses, social workers, the patient navigator, everyone that's a part of the healthcare team. Patients experience their illness in a holistic way, mind, body, spirit, and Overlake really does provide that comprehensive service.
I think the most important thing about patient communication is to really take the time to listen. If you really take the time to listen to what their individual concerns and fears are, that you're going to do a much better job of taking care of them in a difficult time.
A lot of the times it's difficult because when people get hit with the news that they have a cancer, things kind of shut down. It becomes very difficult to hear what you're being told. It becomes very difficult to think beyond the word cancer. So open lines of communication and interchange and discussion of the process is really critical, especially in oncology.
I think communication of patient and doctor is one of the most important parts of treating any disease. I like to spend a lot of time with my patients talking about what exactly we're going to do, what to expect on day 1, 2, 3, 4 after surgery, what our goals are going to be.
So we'll look at what's the psychosocial needs of the patient, what are the spiritual needs of the patient, what are the financial needs of the patient, and we'll customize the care to meet that individual's needs. So you're not just a cancer patient coming to Overlake, you're a unique individual that has cancer.